Throughout the month of June and now into July, there have been no temporary disruptions in service at the Shaunavon Hospital and Care Centre. This has been due in part to the assistance of a Swift Current physician offering his services in Shaunavon on Tuesdays and Thursdays, and in turn keeping the emergency room and acute admissions open 24/7. However, the Cypress Health region is indicating there may be a few bumps in the road in the coming weeks.
Yeah, he's decided that it's been really stressful in the sense that that's a big commitment to be making, and at this point he's going to only continue with Tuesdays and every other weekend. So at this point we have that Thursday evening again that may start to cause us some challenges, but we knew that this would could be the potential, and he's helped out for this period of time, but we're now looking for Thursday evenings again, or that night shift for on-call to try to cover.
Despite the latest development, Vachon states the recently hired locum physician for the Southwest may be able to fill in the gaps from time to time in Shaunavon. In the meantime, the Cypress Health region continues to meet on a regular basis with representatives of the town and surrounding communities to eventually introduce a new model of healthcare at the Shaunavon Hospital, using similar ideas already in place in Nova Scotia. A concept which has proven to be successful out east, and which Cypress Health region and Shaunavon reps saw firsthand a few weeks ago during a fact-finding mission to Canada's East Coast. Ideas which would be molded to fit the healthcare needs of Shaunavon and area residents.
For those few people that come in, they have a nurse and a paramedic who have access to a physician over the phone, and they're able to either treat and release, treat and transport, or treat and then set up for a follow-up appointment the next day in primary health care. So they're finding this great success. It puts less burden on the physician community in any given one of those locations, because they aren't trying to do an unmanageable on-call rotation.
Welcome news for the town of Shaunavon, which lies in the heart of oil and agricultural industries, further increasing the need for 24-hour healthcare service.
The Southwest has made many changes before, and I guess this is where we will take a leadership again and making changes in rural health care, and hopefully it will be successful.
Mayor Dickey goes on to add that the new style of healthcare proposed for Shaunavon will also benefit the town from a cost perspective.
In fact, we've been freed up of some of our funding, because when doctors have left the Avon clinic, the town of Shaunavon always stepped in and maintained that clinic, paid the rent, paid the staff, so that there was some continuity there. And we paid almost a year's rent without a doctor last year. Now that's no longer required, because everything will be the new doctor that is coming, or the temp doctor is working out of the hospital.
The Cypress Health region hopes to implement this new style of healthcare service at the Shaunavon Hospital in the coming months. And leading up to the transition, appropriate staffing complements will need to be secured in the community. Shaunavon is located approximately 1 hour southwest of Swift Current.